I served for 4 years in the Marine Corps Infantry, including 2 combat deployments to Afghanistan and Iraq. And today I want to talk about how those experiences helped shape me for life as a doctor in the ER and why that training helps me serve you better in the moments that matter most. The first point I want to talk about here is actually a combination of 2 things, and those are discipline and work ethic. And these are things that hopefully you have going into boot camp. I think this process does a pretty good job of sort of self-selecting people that already have those traits that will make them successful in the military. And that was certainly the case for me. I think I had a pretty strong sense of discipline and very strong work ethic going in. But these are things that the military will sort of burn into your DNA. So if you have them already, hopefully, they will continue building upon it so that you become even more disciplined with stronger work ethic. If you don't have those things heading in, it may be a little bit of a rough time, but hopefully you learn to have discipline and work ethic. And, if you don't, boy, you're going to have a rough time. But military discipline really emphasizes doing what you need to do, even when you don't want to do it, or especially when you don't want to do it. That includes when you're tired, sick, injured, burned out, unmotivated, or uncomfortable. They expect you to do your job, but to do it well also. And more often than not, you may be familiar with Jocko Willink, and one of the things that he says continuously is discipline over motivation, or discipline equals freedom. And that really rings true in the military because the overwhelming majority of the time, you're not going to be motivated, but you need to then be able to fall back on discipline in order to get the job done or complete the mission. And I think the way that you build this up is through repetition. Essentially, it's just practice. It takes practice like anything else. Maybe another good comparison would be it's like building muscle. You may start out weak, but as you continue to work that muscle of discipline and work ethic, it continues to get stronger, and the discomfort that comes with whatever process you're going through becomes less as you continue strengthening that muscle. And this starts on day 1 of boot camp with something simple like making your bed. You're expected to do it every single day, but again, they expect you to do your job, but to do it well. So that bed has to be pristine. It has to be perfect, very taut, a certain measurement with everything. If you can't bounce a quarter off of that thing, your drill instructors will light you up and start screaming in your face. And this is where you start building the habit, exercising that muscle of discipline, because if you can't get the little things right, you'll never get the big things right. And they kind of build this up over time with increased responsibilities and expectations all the way until you're in the middle of Afghanistan carrying out a complex military operation. And then to the extreme, when you've been up for 2 or 3 days straight with little food and water, and it's 3 o'clock in the morning, all you want to do is go to sleep. You're freezing, it's cold outside, it starts raining, you're in a foxhole and it starts filling up with water. It doesn't matter. You still have to do your job. So having the ability to fall back on that military discipline and that strong work ethic that you've built up is a really powerful thing. And this is very similar to medicine. So going back to the selection process, I think a lot of us self-select having these traits or characteristics going into medical school because the journey to medical school through pre-med is a very challenging thing, and you just have to have these things to be successful. But once you're in medical school, you continue working that muscle and building the discipline and work ethic because you have to. Otherwise, you're just not going to make it through. But moving into the emergency department and how this affects me as well as others as a provider taking care of patients, you would want a doctor who's going to work hard for you, work diligently, continue doing what's right, and just essentially doing their job even when they're tired and they don't feel like doing it. You are a professional and you're expected to do your job, but to do it well. And this is certainly true with all medical specialties, but speaking to my experience in the emergency department, the ER is a very special environment where we run at a very high RPM and we burn at a high octane. The shifts can be quite grueling. You're on your feet all day, you're running around caring for patients. You often don't have time to eat or drink much water. You may have several patients that you're taking care of, several of which may be in life-threatening circumstances, and despite how tired, fatigued, unmotivated you are, or burned out, because the ER has a very high burnout rate over time, you are expected to do your job not only do your job, but to do it well in providing the best care for your patients that you possibly can. And I think you as a patient would want somebody like that. The second point I want to talk about is leadership, and leadership is an incredibly important concept that the military also burns into your DNA. So they do a very good job of having you assume small, low-level leadership roles very early on so that you become comfortable not only taking orders, but to give them as well. And so that you're not only comfortable, but also confident in giving those orders to your team, because you're conveying confidence, but that also instills confidence in your team and just makes everything go much more smoothly, because you have to believe in yourself, but ideally you would like your team to believe in you and the mission as well. Stemming from this point, while I think it is incredibly important to be able to assume that leadership role, take on the responsibility, and confidently provide orders to your team, you also have to be comfortable and confident with yourself to be able to take orders. You know, early on in the military, this is kind of the expectation, because as you're a private or private first class out of boot camp, you're not going to be giving too many orders. Most of the time, you're going to be taking all of the orders. But as you get promoted and kind of rise through the ranks, when you assume those leadership roles and become the person who is more often giving the orders than taking them, it's important to understand what you know and what you don't, and to recognize when someone else has a higher level of expertise in a certain situation or subject, and having the ability to set your pride or ego to the side to actually open up and listen to what they're trying to tell you. So an important concept in leadership, which is just as important, if not more, is not only having the ability to assume that leadership role, to give orders and to lead, but also the ability and the willingness and openness to be led, to take orders. A very common example of this in the military is the second lieutenant who just graduated OCS, or officer candidate school, and they get to the fleet. Because they're an officer, technically they immediately outrank even the senior enlisted personnel. However, there's a major gap in knowledge and experience that exists between those two groups. So it's a really tricky balance for these new lieutenants to step into that leadership role and have the ability to confidently give orders to the platoon, while also having the ability to kind of step back and accept guidance from these senior enlisted guys. And that definitely doesn't always happen, but I would say from my experience and just observing that most people with enough time and hardship learn that balance. And the guys that learn it earlier on tend to do better and don't have to suffer as much. Moving into the ER, this certainly applies because the emergency department is a fast-paced, high-stakes environment filled with a large variety of highly skilled professionals. So it's really important as a provider to be able to step into that leadership role and to confidently and clearly give orders to your team, but also having the ability to step back and listen to the experts around you who are essentially trying to help you and your patients. Again, it's important to understand that you don't know everything. There are plenty of people who know more than you. They've been around the block many more times, and you're not always the smartest person in the room, even if you think you are. I think the best comparison here, stemming from that officer to enlisted comparison in the Marine Corps, would be doctors to nurses. So especially coming out of medical school, me coming into the ER as a fresh doctor, I recognize that I essentially know nothing, and that when I get in there, the nurses have been working that emergency department for years, and they know the ER like the back of their hand. They're the subject matter experts. They spend the most time with the patients, and they can make those decisions that they may see things that I would have otherwise missed. They may make recommendations that I never would have thought of, and they may even take action that ends up saving a patient's life where I may have missed it and the patient would have died. And this doesn't just apply to new doctors. I think this is applicable to all physicians. So having the ability to be humble and to listen to your nurses, not only your nurses, but everybody else around you who is essentially the subject matter expert in their field, to understand that you don't know everything. You're not going to catch everything 100% of the time. So having the ability to be humble and to accept their guidance is incredibly important, and will really just lead to a well-oiled machine with communication and teamwork, and really allow you to provide the best possible care for your patients. And that leads us nicely into the next point, which is teamwork and communication. Again, a really important topic in the military, because the military is a very complex thing oftentimes very high stakes in combat, life or death scenarios. And having the ability to work as part of a team and communicate effectively can mean the difference between a patient living and dying. So having the ability to communicate as a doctor with all of the staff, including the nurses, techs, lab techs, imaging specialists, and support staff, is really important. And in having this large team of professionals, those layers of leadership become really important, like the Swiss cheese model, essentially, where everyone is double checking everyone's work to make sure that we don't miss anything or that we don't make a mistake. And again, that can lead to the difference between a patient living or dying. The next point is staying calm under pressure, and this is another thing that the military does beautifully in giving you exposure on a regular basis. So this starts in boot camp on day one when the drill instructors are this close to your face and just screaming their faces off, trying to stress you out, trying to get a reaction, and you essentially are expected to remain calm, still, don't move, don't look around, don't even blink. So they do a really nice job of consistently and repeatedly activating that fight, flight, or freeze response, and hopefully over time you shift into the fight response instead of freezing or running away. And again, this is kind of like a muscle that you build as you're exposed to high stress situations. Hopefully you learn to kind of center yourself and remain calm under pressure. And once again, this extends to combat. When you're in the Middle East, you're getting shot at, things are blowing up around you, people are screaming, you can't see, you can't hear. The natural response is telling you to freak out, to run away, to hide, or to freeze. And it's important to have the ability to kind of calm yourself, remember your training, and complete the mission. But again, this is like a muscle that you build up over time, a skill that you develop. Hopefully you're not starting on day one and then day two you're getting shot at and blown up. They slowly expose you to those stressors progressively so that you build that comfort and the ability to stay calm under pressure. And again, in the emergency department with those life and death situations where your patient may be actively dying, the natural response of your brain is telling you to freak out because something very bad is happening. But having the ability to kind of step back and remain calm in order to think clearly and communicate effectively in order to get whatever you need to do done is really important. The next point is adversity and resilience. And you know what? The Marine Corps has a black belt in adversity and they will beat you into the ground with it. So they have a very interesting way, at least in the infantry, of throwing you into the worst circumstances with the fewest resources and making you absolutely miserable almost all of the time. To be honest, life can suck more days than not, and you're still expected to perform. But again, just like the muscle that you're exercising, that repeated exposure to adversity builds resilience over time so that you handle those situations better, you become stronger for it, and it makes life not suck so much. And I think having that resilience is invaluable in the emergency department as well, because there may be many days where you're exhausted, you're burned out, things may not be going your way, patients may be dying despite your best efforts. And that mental toughness or resilience, along with the ability to maintain your composure, to not become rattled, and to emotionally and physically shut down is crucial because it'll allow you to continue caring for your patients to ensure the best outcome. The next point is professionalism and military bearing. And this is another big point that the military instills into you starting on day one, is taking pride into your work and doing the best possible job that you can. And military bearing, I think, ties nicely into emotion regulation. So in boot camp, for example, when the drill instructors are this close to your face and they're screaming at you, you're expected to basically keep a poker face and control your emotions. And they set very high expectations for you as a professional to set your personal feelings and emotions aside and to do your job and to do it very well. A great example of this in the emergency department would be that patient who's extremely agitated and screaming in your face, sometimes even trying to fight you or swinging at staff, and you're expected to maintain your composure and to be a professional and to provide them the same level of care that you would provide for anybody else. And that bearing comes into play by essentially killing the natural reaction of your brain, which is as you're receiving all of that emotion, anger, frustration, hate, and discontent, it allows you to kind of silence it and to maintain calm and to not fire back. You certainly don't want to escalate, but by remaining calm and providing that care, to help the patient out. But even aside from that extreme example with the belligerent patient who's screaming in your face and trying to fight you, it's important to maintain your professionalism with all patients, because the truth is that as doctors, we're just people. We're human beings. We're flawed. We will have our biases from time to time. And to be truthful, you're not going to like every single patient that you come across and that you're charged to care for. But you are expected to be a professional, to set your personal feelings and emotions aside, and to provide that patient with the best care possible, just like you would provide anybody else. Another strength that I think veterans probably have entering medicine, at least compared to the first-year medical student fresh out of college, is maturity and life experience. And this certainly stems from a variety of experiences, but also just simply by way of time. We've been on the planet a little longer, we've had more experiences, we've had more adversity, we've had to deal with it, and from that we've gained perspective. I think from that perspective over time, you start to understand a little bit better of what actually matters versus what's just noise. A good example from my experience in medical school is really just taking any exam. You know, these exams are stressful. You want to pass the first time, but these younger students who are fresh out of college and don't necessarily have that life experience and perspective, they tend to freak out with these exams. They stress so much and it really just looks like a miserable time. But for me and my fellow veteran students, I think that time was much more enjoyable, or at least less stressful, because we had perspective. While those tests certainly were still stressful, and of course I wanted to pass them the first time, I certainly didn't freak out or stress nearly as much as a lot of my classmates did. And honestly, I'm thankful for my military experience in this regard, because heading in to take a test on any given day, my thought process was always, okay, it's just an exam. The worst possible case scenario is that you fail it. Of course, you don't want to fail it and have to retake it, but the worst case scenario, you fail. And you can always retake it. It's going to be fine. Even in this worst case scenario, my life and my limbs will be intact. Versus in the Marine Corps, when I was in Afghanistan, surrounded by IEDs and people that wanted to kill me, you know, you're never really sure if the next step that you take is going to be your last. So in having the ability to tap into those memories and that life perspective, failing a test really wouldn't be that bad. And I think this ties into me as a doctor in the ER, allowing me to be more grounded, composed, thoughtful, and adaptable. The last point I want to talk about is humor and human connection. So a lot of the time, the Marine Corps can be a really dark environment without a lot of hope and a lot of pain and despair. And humor is a really effective tool that we adopt to deal with those emotions and that hardship in a healthy way. And that allows us to keep moving forward. Because if you don't find a way to deal with that darkness, it can consume and cripple you. But on a lighter side, Marines are some of the funniest people I've ever met in my life, and a lot of the time this humor manifests as extreme humor, a lot of the time dark humor. So if you've ever met a veteran and they say something that makes you just gasp, this is where it comes from. It's a coping mechanism so that we can survive and keep moving forward. And in my experience, I've found people in the ER to be very much like this as well, because oftentimes the ER can also be a very dark environment. It could be a pit of despair pulling you in, and you have to figure out how to deal with that, again, to keep moving forward. So if you've ever been in the ER, you may have noticed that oftentimes a lot of the staff are smiling, laughing, and joking with each other. You know, this may be just normal stuff on the day-to-day if things are going okay, but also sometimes when things aren't going well, they still do this because it's their coping mechanism, the way that they deal with that hardship to keep moving forward and to get the job done and to continue caring for patients. And, you know, I think we actually do this to a fault sometimes. So for example, there may be a patient coming in with a serious condition. They're concerned, their family's there, the family's concerned, and you look around and the medical people are laughing and joking, and that could be a little off-putting probably to the patient and family members. So this is something that we could probably improve on. But if you are ever in that circumstance, just try to understand that that is the coping mechanism and just kind of part of the emergency department so that those workers can continue coming in from day to day and not only survive but thrive. But on the other end, I do think humor definitely has a place with patients and family members where appropriate. This is going to be situation dependent. I think it's fine to joke and laugh with patients if there's nothing too serious going on, just to make the time go a little better for them, to make that experience maybe a little more enjoyable. But even in some severe circumstances where the patient has a serious condition or they're in a lot of pain and they're suffering, I think, again, situation dependent, you can certainly use humor as a tool to try to alleviate a little bit of that stress, that pain and suffering. And you never know, that joke or that smile that you utter to the patient may just make their day. You never know. That may be the one good thing that they've experienced that day, that week, that month, and could really kind of pull them out of that darkness back into the light a little bit. And in this way, I think humor can actually help foster a connection with your patients. One thing I want to clarify on all of the points that I've talked about is that I don't think these traits and characteristics are exclusive to veterans. Not all veterans inherently possess these qualities, and I'm far from perfect. I certainly don't display all of these all of the time. And there are plenty of folks who aren't veterans who do display these qualities going into medicine. And I think if you don't have these qualities starting out, because a lot of these things are muscles that you build over time through repetition and experience, you will accumulate them through training. So I don't think veterans, and certainly myself, I don't think we're better than anybody else. I simply think that having the military background provides us with an earlier foundation for some of these things that facilitates our success along the journey. And if you're interested in hearing more about my journey from the military through 4 years of medical school to now starting ER residency, go ahead and check out this video over here where I walk through that entire journey from day one through graduation. Thanks for watching, and I'll see you in the next one.